Hi everyone. So I'm going to be going over this week's lecture, or not lecture, sorry, discussion. So question one, what do you think, what do you see as the role of psychopharmacology in treating substance-related disorders and possibly other addictions? Okay, cool. So based on what I've learned about the etiology of addiction, I now understand that addiction is a complex chronic brain disorder rather than a simple matter of poor choices and lack of willpower. And this idea, while it is affected by what we have been learning, I think it even goes further back for myself for maybe 2 semesters. I don't remember what class it was, but it was one of the class where we had to go attend like some form of like support group meeting, I believe it was, and I went to an AA meeting. And I'll be honest, before that, I did kind of have an idea of it's not that hard. You just need to kind of put your mind to it. But after kind of going to that one meeting, and it only took one meeting, honestly, and seeing people talk about their struggles, I kind of learned and finally understood. I think that it is more than just willpower, and it's a really complex thing to deal with when it comes to addiction. I, something that I also learned, not just because of that, but throughout the lectures and the readings and the program in general, is that addiction develops throughout a combination of biological, psychological, social, and environmental factors. And beforehand, I think I only thought about it as like which where would it fall? Like mental. Um, but yeah, now I think I don't know. I'm happy that I went to that one meeting for that one assignment in whatever class it was, and it kind of opened up my eyes and understanding and gave me a better understanding of addiction. Um, Anyways, I'll kind of continue with the question, and well, repeating like substances use changes the brain's reward pathway, motivation, memory, and impulsive control, making it much more difficult for individuals to stop using substances without support, something I did not understand in the past. Because addiction involves changing the brain chemistry, I believe psychopharmacology plays a significant role in treatment. Medications can help restore some of the brain's chemical balances while also reducing withdrawal symptoms, decreasing cravings, and lowering the risk of relapse. By addressing these biological aspects of addiction, medications can make recovery more manageable and increase the likelihood that individuals remain engaged in treatment. There are several examples of medications that have been shown to be effective for opioid use disorders. Medications such as methadone and uh, buprenorphine help reduce withdrawal symptoms and cravings while preventing illicit opioid use. For alcohol use disorders, medications like naltrexone can reduce the reward effects of alcohol and decrease cravings, while acamprosate helps maintain abstinence after detoxification. And then, although medications are less commonly used for behavioral addictions such as gambling disorders, they may still be useful when individuals have co-occurring conditions like depression, anxiety, or obsessive compulsive symptoms that contribute to the addiction, or in this case, addictive behavior. Overall, I see pharmacology as an essential component of addiction treatment. While it's not a cure, it provides important biological support that allows individuals to better participate in therapy and focus on building long-term recovery. I kind of always go back to the analogy when it comes to medication of kind of like that ladder and like being dug in a hole. That's kind of what helps me best to understand and see medication. I would apply it to the same thing. Medication is not like a solution, it's more so like a little support to overcome the challenge that may be facing. And that's why I believe psychopharmacology is really essential in treating addiction and many other mental health illnesses. In terms of question two, what do we believe psychopharmacology can provide and what might be a limitation? Well, I just kind of give an example about that regarding the analogy that I've used, I think probably even last discussion. But I'll go kind of further in more for this specific question. I believe it provides several important benefits, but also has clear limitations that should be recognized. One of the greatest benefits is medication can reduce cravings like withdrawal symptoms, stabilization mood, and decrease the likelihood of relapse. These improvements can help individuals feel more physically and emotionally stable, making it easier for them to remain in treatment and actively participate in counseling or other recovery programs. I also think it can improve quality of life during recovery when people are not longer overwhelmed by intense cravings or withdrawal symptoms. They are better able to focus on repairing relationships, maintaining employment, returning to school, and developing healthier routines. However, I don't believe medications alone is enough to treat addictions. As I said earlier, it's kind of like the whole ladder analogy. It's just kind of like a little support ladder. Um, the ladder just kind of appears. That would kind of be like the medication, and every step we take is kind of like attending some support group or treatment, like psychotherapy or something like that. In this case, addiction is influenced by many psychological and social factors, including trauma, stress, family dynamics, peer relationships, and leading coping behaviors. While medication can treat the biological effects of addiction, they cannot treat someone's healthier way to cope with stress, regulate emotions, or change the behavior that contributes to substance use. And another limitation is that medications do not work the same for every people. Such same thing with like the interventions or theories of not there's no one fits all type of deal. Same thing applies for medication. Some individuals may experience side effects, with others may not respond well to particular medications. Certain medications also require close medical support supervision because they can carry risks of misuse or dependence if they are not used appropriately. Because of these limitations, I believe the most effective treatment combines psychopharmacology with evidence-based psychotherapy. Therapies such as CBT, motivational interview, and cognitive contingency management help individuals understand the thoughts and behaviors that contribute to addiction while developing healthier coping skills and relapse prevention strategies. Medications can help stabilize the individual's biological, while psychotherapy addresses the emotional, behavior, and social aspects of recovery. This is kind of the part where I was kind of talking about the whole ladder thing with the medication being stabilizing the individual's biologically, kind of being like the ladder, and then the psychotherapy, which addresses the emotional, behavioral, and social aspects, kind of being what helps start slowly climbing that ladder to overcome the symptoms or the situation that might be going on with, in this case, addiction. But in conclusion, I believe psychopharmacology is a valuable tool, but it should never be viewed as a standalone treatment. Instead, it works best as part of a comprehensive, person-centered approach that combines medication, psychotherapy, social support, and long-term recovery planning. When these approaches are used together, they provide individuals with the best opportunity to achieve lasting recovery and improve their overall quality of life. This was a pretty long video, so sorry about that, but thank you for your time.